Welcome, doctors. Let's talk about something that affects your bottom line more than most people realize, ICD-10 and how it ties directly into your revenue cycle. I know, just hearing ICD-10 inches can bring back memories of those transition headaches. But today, I want to walk you through what really changed and how it still plays a big role in how you get reimbursed. So let's start here. ICD-10 isn't just an update, it's a full-blown upgrade. With over 70,000 diagnostic codes and 75,000 procedure codes, ICD-10 brings a level of detail that ICD-9 could never touch. And that's good news for your revenue. Why? Because more specific codes mean you can justify the medical necessity of your care much more clearly. When your documentation is spot on, payers have fewer reasons to push back, and you're more likely to get fully reimbursed, not just partially. But, and this is a big one, it all hinges on your clinical documentation. If the notes aren't detailed enough, your coders can't choose the right code, which delays billing or worse, leads to denials. This is where collaboration between your team and your coders becomes mission critical. ICD-10 demands more from both sides, you, providing the detail, and your coders, turning that into compliant billing. Here's the tough part, with more codes comes more room for error. It's easy to miscode if your team isn't trained well or if documentation is vague. And we all know what follows: payer rejections, audits, and delayed payments. So this is where regular coding audits and staff education really pay off. A single mistake might seem small, but over time, it can lead to significant revenue leakage. Now, yes, ICD-10 did come with some upfront pain. Training costs, system upgrades, workflow changes, you felt all of it. But over time, those investments have paid off for the practices that stuck with it. Well-trained teams mean fewer denials, faster claims, and less back and forth with insurance. It's about building that solid foundation, so your revenue cycle doesn't wobble every time a new code rolls in. And here's something not everyone talks about. ICD-10 has opened the door to better data analytics and risk adjustment. This means smarter reporting, stronger negotiating power with payers, and more accurate value-based reimbursements. You're not just coding anymore, you're telling the full clinical story of your patient. That matters a lot more now that healthcare is shifting toward outcomes and quality. So, what's the bottom line here? It made things more complicated up front, sure, but it also gave us a much clearer, more accurate way to connect care with reimbursement. If you want to protect your revenue and reduce denials, it starts with clear documentation, smart coding, and constant learning. And the good news? You don't have to go it alone. At Staffingly, Inc., we help practices just like yours handle the complex stuff, whether that's coding audits, training support, or full revenue cycle management services. So you can focus on what you do best, caring for your patients. By the way, if you're wondering, what is ICD-10? It's the current system we use for coding diagnoses and procedures, more detailed than ICD-9, and far more accurate. Does it really help with reimbursements? Absolutely, if it's used correctly with proper documentation. Why do denials still happen with ICD-10? Mostly due to incomplete documentation or coding mistakes, which are both avoidable with the right support. Thanks for watching, doctors. I hope this helped make sense of how ICD-10 still affects your revenue cycle. Keep your charts strong, your codes precise, and your revenue flowing. See you in the next one.